Good morning, goeiemorgen, dumelang. Welcome to the Road to Elections, your roadmap to the 2021 local government elections. I am your host, Karabo Khakhau. Ketwadi ya mo Afrika ngwana mosotho yana ka sebele. Mukubu wa motsatsa mothibedi, kubu ntshama rota re bone. South Africa, in less than 2 weeks, you will make a choice that could change your life. Remember, on the 1st of November, South Africa goes to the polls. You get an opportunity to vote. And so you can choose corruption and empty promises, or you can choose the only party that gets things done. Only the DA has the plan to get the basics of governance right, and only the DA has a proven track record of service delivery. No other political party in this country can claim this. Indeed, we get things done. Today, we unpack the DA's manifesto of getting the basics right, building sustainable housing and improving healthcare. So let's keep the conversation flowing. Post your comments and questions on our Facebook and YouTube pages. This is indeed, after all, your manifesto, and we want to hear your voice. Remember to check your registration status at check.da.org.za. That's check.da.org.za. Joining me to unpack our offer is the DA's head of policy, Gwen Ngwenya.
The Democratic Alliance spends your money on delivering services where we are in charge. Unemployment is the lowest and we do not tolerate corruption. Even the national government admits the best-run municipalities are all governed by the DA. But the choice is yours. You can choose collapsing basic services or streets that are maintained and clean. You can choose to live in chaos and fear, or the protection of thousands of local law enforcement officers. You can choose blackouts and the devastation of livelihoods. Or you can choose a DA government that is creating jobs and working to become load-shedding free. The DA is the only party that brings all South Africans together, and the only party big enough to bring positive change to your municipality. In this election, choose the DA, because the DA gets things done.
Gwen, the DA's manifesto begins with a simple promise of getting things done. What do we mean by this?
Well, we're focused on getting things done and also getting the basics right. I mean, that's really what we talk about in terms of we get things done. We are talking about our extensive track record of being in government and really where we govern, highlighting the importance of getting the basics right and of good governance. And I think I'd also just add, that municipalities essentially operate on a kind of Maslow's hierarchy of needs, if you will, and sound governance and the provision of basic services forms the bedrock of other municipal aspirations. So in places where we govern, we are trying to go beyond, obviously, the basics, but in many municipalities around the country where the DA will be coming in and governing for the first time, or maybe sometimes for the first time with a majority, we are going to really need to actually get into it before, when we've spoken about municipalities and the state that they are in. That's just towards the end of last year, we learned that close to 1 in 5 municipalities in South Africa are either under administration or close to being placed under administration. And by the time things get that far, it usually means that municipality's executive is no longer meeting its governance obligations or any of its executive obligations. And if that is the state of many of South Africa's municipalities, it means that we can't look to higher order needs. We can't start looking at, well, how do we really drive economic growth? How do we really even ask for increased mandates? So in some areas, we're talking about the need for devolving, for example, rail or other transport services, and also devolving or decentralizing policing functions. But that can only happen in stable municipalities. So that is really why it's so important to focus on getting the basics and getting those done first.
Yeah, and speaking of getting things done, Cape Town was praised internationally for beating Day Zero. So take us through what the DA has learned in the Western Cape about effectively fighting water scarcity?
Well, the relevance for this particular electoral manifesto is what other municipalities can really learn from that experience. And essentially what happened is that, residents in the Western Cape broadly, not just the city of Cape Town, and that includes households and businesses, they learn to really become water wise. So South Africa is still generally considered a water scarce country, and we are still providing or still promoting sustainable water use in this particular manifesto. So interventions such as, the use of grey water, making sure that in consultation with municipalities, we talk about how households can better manage their own consumption through, for example, the use of water management devices or meters. And this really emphasizes also the aspect of our manifesto where we talk about rights and responsibilities. The fact that residents have both rights or there are certain entitlements that they have that the municipality has to deliver on. But at the same time, they also have a responsibility. And that dual relationship is no better emphasized than in the instance of water delivery, where it really is a partnership between each municipality and its residents to ensure that everyone has accessible, water.
And an integral part of being able to run an efficient government is having the money to do so and being able to control it properly, right? So tell us then what the impact of the budget restrictions human settlements has imposed on South Africans are.
So many municipalities rely on national transfers to deliver particular services, and housing is one of those which are really strongly affected by what happens at the national level. So certain grants, for example, the Human Settlements Development Grant, and really what this is used for, it's used by provinces as well as some municipalities to build formal houses, which are then awarded hopefully in the end with title deeds. So that has had a significant cut. Also the Urban Settlement Development Grant, and this is used by especially densely populated municipalities to ensure that our country's poorest residents, and we are talking here especially those living in informal settlements, have access to services including taps and toilets. And then also the Title Deeds Restoration Grant. And this in the past has been touted as apparently being a priority program by the department. However, there's been little progress here, and it also has seen its that particular grant has been cut. So all of these different grants, which really feed into housing delivery, have seen drastic cuts, and this directly affects, of course, what governments are going to be able to offer at the local level. And it's in that context, which is so important to understand, that the DA has then been really talking about, well, if government delivery is going to be reduced in housing, how do we equip and enable households or individuals to build their own housing sustainably? Because don't be mistaken, people are building their own homes anyway. People aren't waiting for government to build them homes. We already see construction, a lively construction market in urban areas and township areas especially, but unfortunately people don't always use the most sustainable or the correct materials to make that housing safe. And so it is important now that we also shift to enabling individuals, households, communities to build on service sites sustainable housing for themselves.
You've just outlined now how the reduction has negatively impacted municipalities and communities in general. But where has the money been directed to? Where did it go?
Well, it's complicated. I mean, some of the funding does go towards, in theory, was supposed to go towards emergency housing, especially as we saw during the COVID pandemic. But this really hasn't being directed adequately to that area. We've seen very little development happening. And so instead, you've got money being diverted from formal housing projects, which are important for the long term, for short-term programs, which really haven't really delivered that much at all. But aside from any reallocation in the department itself, we've also seen other vanity programs nationally be funded, which could have been money that was directed towards housing or other areas of service delivery. For example, the ETOL program received 2.5 billion rand. That's a significant allocation to a program that really has very little public support.
So the DA's approach or the DA's policy on healthcare, the plan is a very holistic one. In the sense, it's trying to curb all the problems of all the underlying issues of healthcare. Take us through this approach. What does it mean? What exactly do we want to do?
Well, essentially, first, the primary healthcare system's main collaborating with communities and also preventative care. So it's really at that level that local governments are best placed to be able to intervene because they are closest to those communities. And we saw that become particularly important during the COVID pandemic, where if you think about it, water quality and provision, which was so important as part of the initial and ongoing message around the management of the pandemic, sanitizing and washing hands, etc., which goes back to, well, do people even have access to water to be able to fully comply with that kind of, and I think so the COVID pandemic really helped to highlight the relationship between primary healthcare, which is healthcare in general, and other socioeconomic conditions for which local government is responsible for. So, not just water provision, but, also many households still using bucket toilets or, refuse not being collected, all of these, as well as obviously then unemployment and poverty, which whilst mostly that kind of policy arises at the national level, certainly if service delivery is done right and municipalities are working and stable, that does also attract business, high unemployment rates, extreme poverty, lack of access to water, quality water and water provision, a high number of citizens living in, surrounded by sewage, using bucket toilets, etc., that then increases also the incidence of disease and places a greater burden on district health systems. So it's important to see basic service delivery as not isolated from the function of primary health care, but all of those departments have to work together in order to improve health outcomes at the municipal level.
And you highlighted waste collection as something that obviously impacts the health of communities on the ground. What are some of the innovative strategies that we have as the DA to collect refuse?
Well, to be fair, they may not be entirely innovative, but I think we're doing them where we govern particularly well. So in Stellenbosch, for example, we have that recycling facility that really helps communities, and we speak about this in the manifesto as well, about the need to increase the number of buyback centres where residents can, recycle their goods, which is really, really important, and also separation at source, which again is something that is not unique to DA municipalities. Many municipalities have tried it and often failed, but Saldanha Bay, for example, is making an astounding success from there. So we also want to use what we know from the municipalities that are doing these interventions right, to use as a benchmark or as a model for those other municipalities that may still be struggling. And I think that is the strength of a political party that already has a track record, that we have instances or areas that we can learn from to inform those municipalities where we may be governing for the first time, where maybe some of those challenges still exist. So I really want to emphasize here, it's more about the depth of experience and the fact that there are success cases in places where we govern that allows us to improve something like waste collection, even if it's not necessarily particularly new.
Yeah, we are less than 2 weeks out of an election day. On the 1st of November, South Africans will have an opportunity to choose right and to choose a government that will do everything that you just outlined right now. Tell us just your final thoughts about what it is that you think South Africans need to know moving forward.
Well, I always take any opportunity to stress the fact that this is a local government election. Being somebody involved in policy myself, you cannot believe how many times I'm inundated with questions during a local government election on issues that really have nothing to do with local government at all. Some of that is due to politicians being irresponsible and making promises which local governments are in no shape or form actually capable on delivering on. But I just want to urge people to, go outside, or actually, your own home, you know, turn on the tap, turn on the lights, those are the kind of things. Look outside your house or your apartment or your flat, whatever it is, your residence essentially. Look at the state of your roads, look at where there's litter on the floor, look at the state of your public facilities, essentially look around your local community. Those are the issues that this local government election is about, and that should inform your voting decision.
Okay, thank you very much, Gwen. Now, South Africans, remember you can join the conversation by posting your questions and comments on YouTube and Facebook, or send us your voice notes on WhatsApp on 063 991 8375. That's 063 991 8375. Up next, we further unpack our manifesto. We now turn our focus to the DA's existing record of action in the 26 municipalities where we already govern. To unpack this further, I'm joined by Geordin-Hill Lewis, our DA mayoral candidate for the city of Cape Town, Dr. Mpho Phalatse, the DA mayoral candidate for the city of Johannesburg, and Tertius Simmers, the Western Cape Provincial Minister of Human Settlements. Hello, everybody. Welcome.
Hi, morning, Karabo.
Morning.
Great stuff. So, Jordan, I'll start with you.
Yeah.
What are some of the things that the city of Cape Town has done to improve water security?
Thank you. Good morning. It's really lovely to be with you, and Tertius and Mpho and Gwen, all of our colleagues, great to be with you, and of course our viewers at home. So, as everyone knows, in South Africa and around the world, Cape Town went through a really devastating drought. It's the first time, probably in hundreds of years, that Cape Town has had 4 years of really bad drought. And we learned some really tough lessons about what we can rely on our colleagues in national government for. Remember that constitutionally and ordinarily, the provision of what we call bulk water, so essentially dams, is the responsibility of national government. But when there's been decades of underinvestment in new infrastructure, and then you get this terrible natural disaster coming along, you get this drought. So we have now committed to saying we want to protect our residents from that kind of seriousness, serious drought happening again. We know that Cape Town is getting drier and drier, mainly due to the changing climate. And so we are investing, in the region of 5 billion rand over the next decade in augmenting or developing new water infrastructure in Cape Town, so that by the end of this decade, by the end of 2030, we will in Cape Town be able to provide around 300 to 350 million litres a day of new water source, mainly from alien clearing, which is a huge user of water, and drilling into the aquifer and wastewater recycling. So I think that's going to be the first municipality in South Africa that does that. And using those three main technologies, we're going to be able to really look after our residents and make sure that even if we do have such a terrible drought again, that we don't nearly hit our day zero like we did in 2018 it was.
Yeah. No, well, definitely those are clear blue waters that exist there, and it's super exciting to learn.
New blue waters.
New blue water. So, but Gwen, to you, between 2016 and 2019, the DA took over the city of Johannesburg. So tell us, what are some of the infrastructure replacement projects or initiatives that we've done there?
Karabo, thank you. So, I think, as you mentioned, we've done a lot of work in terms of the infrastructure.
Gwen.
Technical.
Okay, there seems to be a technical issue there, that's okay. But Dr. Phalatse can come in here, actually. So we've made infrastructure replacements there. They've clearly been working out for us. But tell us now, as mayor in the city of Johannesburg, what is your agenda? What do you plan to do to ensure that Johannesburg is water secure?
So in Johannesburg, we've got a dependency on rainwater for our bulk water supply. We know that rainwater has been incapable of actually investing in their infrastructure. Jordan just spoke about that. And so we're seeing that whenever they feel like it, they just impose undue restrictions on municipalities, and Gauteng at large is experiencing that right now, where they imposed a 20% restriction because they wanted to maintain their infrastructure. However, that shouldn't affect us too badly if we organize on the inside. However, it's coming against the backdrop of a Joburg government that's also incapable and that's also for years has neglected investment in infrastructure. And so our infrastructure is not in a good state. In fact, only about 18% of our infrastructure, our water infrastructure in particular, has a lifespan of 10 years. The rest can be considered to be in a critical state. So we need to invest in infrastructure replacement, infrastructure upgrades. Our backlog in terms of water infrastructure is at around 12.5 billion rand. And we also, on the other hand, have losses, which are also a huge issue. We're losing about 44% of our water in Johannesburg, which is something we need to sort out. So what needs to happen? What needs to happen is, going forward, we need to invest heavily in infrastructure repairs and maintenance. That's what we're going to do as the incoming government after the 1st of November. But we also need to invest in future growth. Johannesburg is the economic hub of the country and of the continent, and people are drawn to Johannesburg in search of better opportunities. And so we've got this rapid population growth. And with rapid population growth, you need to then adjust your infrastructure or make sure that your supply is adequate for your demand. So we've got this rising demand all the time against infrastructure that's not being maintained, and we're not investing in future growth. So on the one hand, we need to invest in repairing and upgrading our existing infrastructure. We need to declare war on leaks, on water leaks, to also save what we do have. And we need to build reservoirs in order to invest in future growth. Let's talk a little bit about leaks. Leaks get reported very well in affluent areas where people are paying rates and they're therefore concerned about the losses. But there are areas like Soweto, areas like Joburg South, Ivory Park, where we have a flat rate for water, and so people are not incentivized to report leaks. In those areas, we need to do proactive leak detection by sending people in to check. But how are we going to monitor? We need to install smart meters so that we can monitor utilization and pick up if there are trends that are suspicious of losses. And then we need to send people in there to sort out those losses. We want to repair in 24 hours, so we'll be very strict with our service standards to reduce our losses and keep what we have. But I also like that the DA at National is pushing for us to be free of rand water dependence, and I'm waiting for the day that happens.
Great stuff. So Gwen, tell us, so Dr. Phalatse right now just outlined exactly what we need to do. But earlier on, I wanted to rope you in here. We had between 2016 and 2019, we had an extensive replacement of infrastructure there. Take us through what exactly happened, how we got there, and how we turned the strategy around.
Well, I think Mpho's covered quite a lot of ground in terms of what needed to be done in this area, or what needs to be done, especially in the city of Johannesburg. But maybe without covering the same ground, what I can add there is that I think this is an area that is often neglected by many municipal governments, particularly because it happens below ground, so residents can't see it, and it's really an investment in the future as opposed to short-term gains. And it's incredibly difficult for a government, when you want to demonstrate to residents that you are getting things done, to do those things which are actually largely unseen and for which you may not actually get the reward, because the benefits are experienced years later when infrastructure doesn't fail. So I think one of the most important things is for residents and governments to really be in conversation with each other when it comes to, for example, infrastructure refurbishment, because it's about short-term pain, but for long-term gain. And many municipalities neglected that, and residents now today are experiencing the challenges. It's not to say that residents won't benefit, it's just the benefits aren't necessarily always immediate. But it is important to recognize that, by maintaining water infrastructure, that you're really investing in in savings of water utilities, also avoiding costly and frequent disruptions in future. I mean, I live in Johannesburg, and whilst there was a great done in that period, it needs to continue, and it's still not enough to catch up with the backlog that existed. And never mind the cost to households, there's an enormous cost as well to businesses, because frequent disruptions also mean frequent disruptions on businesses, some of which are obviously reliant on running water, and that means a knock-on effect on revenue and GDP, etc. So it's really important to view the maintenance as integral to the long-term financial and overall stability of that municipality.
Yeah. No, you're absolutely right. Speaking of pain, another thorn in every South African's life is load shedding. Jordan, take us through what the City of Cape Town's strategy to end load shedding is.
Thank you. I'm really passionate and excited about this, because I think Cape Town can be the first major city in South Africa to protect its residents from load shedding. Wouldn't that be an amazing thing? 15 years of load shedding we've had as South Africans, and what an outrage, totally unnecessary. So already Cape Town protects residents from stage 1 load shedding. And so when the country has stage 1, we have nothing. When the country has stage 2, we're on stage 1, and so on. And the way that we do that is by using the Steenbras pump storage system at Salari's Pass. And I just want to say, there's been a few people who have written in and say, yes, but the DA didn't build that. And of course, that's true. We didn't. But the thing is, it is well run. It's maintained. We've invested in revamping it and upgrading it several times over the last decade. We're about to do another major upgrade and maintenance project on it. And that's why it works. It's reliable. And that's exactly what hasn't happened with infrastructure everywhere else in the country. We've just heard Dr. Phalatse, my colleague from Joburg, and Gwen talking about how infrastructure is literally crumbling because of bad leadership and bad management. And that's why I always say politics does matter. Good governance does matter. That's what makes the difference in these things. But just to answer your question, now we've got the chance to go beyond just stage 1 and say we can actually protect residents from further stages of load shedding by investing in our own independent sources of power and storage in Cape Town, and slowly over time reducing our reliance on Eskom. It's going to take time, and I think that we will have some pushback from national government and from Eskom, but it is absolutely technologically possible. We've got wonderful sun and wind in Cape Town. All of the technology is there. All of the financing is available. What we need is the firm political commitment to get this done and to push open those doors even when national government tries to close them. And that really is the DA difference. We talk often about that difference, but that is it. We are going to do our best to try to give you the peace of mind that all of these service delivery failures will affect you less and less because of the DA.
So it's not only a matter of maintenance, but it's also a matter of coupling the maintenance with innovative strategies to ensure that at the end of the day, residents are put at the center of comfort altogether. So okay, thank you very much for that, Jordan. Tertius, affordable housing is a hot button topic in South Africa altogether. So run us through, and obviously the DA takes that seriously, right? But take us through what are some of the main plans that we have to provide more affordable housing closer to working communities, working opportunities.
No, indeed, that is the hot topic of discussion in the city of Cape Town, but also across the Western Cape. And as such, we've made affordable housing, or the acceleration of these opportunities, as the center of our key strategy and plan, which we have systematically implemented since 2019. But also we have realized that, we do need private sector partnerships. But from our side, we also have leverages of certain programs within the human settlements family to unlock these opportunities at an accelerated pace, obviously more so for the city of Cape Town. One such example is the FLISP program, where in the Western Cape we have actually gone above and beyond that by ensuring that the banking sector has access to our housing demand database system. But just to focus on one specific type of project which does speak to our strategy is the Maitland Muse Social Housing Project, which we will be turning the sod in the next few weeks in the city of Cape Town, which is actually, it's near all social amenities, it's near the transport facilities, it's within walking distance of the various economic and industrial centres, more so in Maitland, but also the surrounding areas. So that truly speaks to the objective of the Western Cape government of affordable housing, but the City of Cape Town have also come on board to ensure that we accelerate the housing plan approvals for the specific project. So at the core is our acceleration of these opportunities by granting our possible qualifying beneficiaries access to more resources to ensure that they do get this opportunity in the City of Cape Town, to be specific.
And speaking, yeah, super amazing. So speaking of collaboration, I know that you're working with the City of Cape Town. There's a new development that's coming up. It's called the Kunradi Better Living Development Model. Tell us about that. What does it entail?
No, indeed, this is a mega mixed income, mega project. I use the word mega because it's really big. Over the next 8 to 10 years, it will yield 3,600 mixed-use human settlements opportunities, which means it will range from social housing to fully bonded options to qualifying beneficiaries. But I do believe it's also historic in terms that it also has the first vertical FLISP development, which is the first of its kind in South Africa. And once again, we're in partnership with the City of Cape Town, the Provincial Department, but also Concourse, the developer, and the Social Housing Institute. But so far we are already looking at the first 530 social housing opportunities being availed within the next financial year. So this is the DA difference. We're not talking, it's not plans, we are getting it done.
Yeah, and I must just add to that, it was great just a couple of weeks ago to actually take a drive around the construction site there. Tertius will have been there. It's great to see the cranes, the workmen on site, that building going up before our eyes, all of that infrastructure being put in. Really a very exciting project, and hopefully after the 1st of November with the public support, I look forward to working with Tertius on making that happen.
Yeah, no, that should definitely happen. But Tertius, also tell us, because we don't only want developments that are sustainable, but we want those that are modern enough and close to working communities. So this development project, in its essence, the Kunradi Better Living Development, how does it solve, one, the problem of cost, and two, the problem of distance from working opportunities?
Well, first and foremost, in terms of cost, because the land was made available by the City of Cape Town, the ultimate cost per unit is brought down. And the social housing aspect, once again, it's to integrate various community typologies together. But also what will form part of the bigger Kunradi Better Living Model exemplar is that, we are going to build schools. There's going to be a shopping mall, and at the ground level of all the social housing units, there is actually going to be stores there as well, so there's going to be business opportunities as well. And because the physical site, and like Jordan said, I have been there, it's also near other amenities, but it's also integrating this new mega human settlement, to be quite honest, with the surrounding communities that is near it as well. And we also obviously breaking down the apartheid spatial planning legacies with this specific project, which is something unique to the DA-governed Western Cape, but more so to the DA-governed City of Cape Town, which is a true legacy, I think, for all of us as proud DA members.
Yeah, here. And part of what makes developments and communities work, right, is cleanliness altogether. So, Jordan, what are the plans, what are the City of Cape Town's plans to ensure effective waste removal? Because, we can't have the Kunradi development and not have a clean Kunradi development altogether.
See, this is unfair. Tertius gets to talk about exciting new housing developments, and I've got to talk about trash collection. But this is essential, right, for clean communities. But, I really am proud of what the DA does. Most informal settlements in Cape Town have got trash collection twice every week, and some places even 3 times every week. And there's large parts of the city where we've got separation at source. So people have separate recycling bins, and the city collects that once a week as well. But what I think is really exciting for the future is that the city owns these enormous dump sites that are just filling up with trash every day. And there's a lot of valuable material there. So we can do a really good public service by going and separating all of the recyclable plastic and metal out of those trash heaps and actually selling them, so the city has more resources to then deliver basic services, and we're achieving making those smaller and smaller, so you've got longer lifespan on those trash heaps. And I think that's a great outcome for the whole city and residents.
Yeah, absolutely, I agree. Tertius, back to you. So, well, speaking housing, the ANC has been dragging its feet, as they always do with everything they used to do, with regards to the issue of title deeds. For the longest of time, that's been the case. Give us the contrast between the DA's approach of issuing title deeds as opposed to that of the ANC.
Thank you. Well, first and foremost, we need to understand that the title deed restoration grant hasn't been reduced. Karabo, it's been stopped. It's from the 1st of April, it doesn't exist. So what we have done as a DA provincial government, we've actually, through our department, have used our own funding to continue providing and ensuring that we do provide title deeds to qualifying beneficiaries, but also we seek to address, the legacy of individuals who's been living in some of these settlements for many decades without ownership. Whereas the ANC in their governed provinces, we've seen a steadily decline in the number of title deeds that's issued. We have actually outperformed every target that has been set by the National Department for us. As a case, an example, the 2019-20 cycle, once again, utilizing our own funding, I need to say, we set a target of 7,100. We accomplished just under 8,500 title deeds. In the current financial year, once again, we are set to over-exceed our target, and we have availed sufficient funding. It's close to 100 million rand until the end of my term in office that we will seek to address the issue of title deed, but also the title deed backlogs. Sadly, in ANC governed municipalities in this province, but also in other provinces, we will never see true ownership happening, because ultimately they want to impoverish the citizens by ensuring that they never have access to that title deed, whereas at the heart of everything that we as a DA provincial department and government does, we want to ensure ownership, because ownership unlocks future possibilities. And we have seen various success stories where we have handed over title deeds for individuals that are 70, 80, and the eldest person was 91 years old, being the first in a generation to have ownership. And ownership for them means unlocking future possibilities. And once again, we are proving as the DA in the Western Cape, together with the City of Cape Town, when we also do title deed transfers, we're getting it done, but we're getting it done to ensure a better future for our kids.
If I can just add something to that, I mean, I find that so inspiring. I remember Tertius's first speech when he became the provincial minister was dealt almost totally with title deeds, and he's really followed that up with action, as he's just explained to you. And I just love that. That is such a great example, a moving example of what we call the DA difference, because as he says, everywhere else in South Africa, you are basically a permanent tenant of the state. You don't have the ability or the right to own that asset. And here and elsewhere where the DA governs, and hopefully in Johannesburg after the 1st of November, actually people get to own that asset. Isn't that amazing? I mean, that really is the DA difference. That is what, there's so much talk about empowerment in South Africa, but that is real empowerment.
And that it's, yes, Tertius.
So if I can just come in there, and Jordan spoke about empowerment, I'll use one practical example of a beneficiary in Khayelitsha in the City of Cape Town. She's a single mother of 3, the father passed away. We gave her a title deed in 2020. She has managed to actually get a loan, obviously against the value of a property, to ensure that her eldest daughter can now go to university. So that's unlocking and breaking the cycle of poverty in Khayelitsha. Once again, a DA difference.
And I can absolutely attest that this is not the case in the Free State, a completely ANC-run and not DA-run province. Dr. Phalatse, let's speak healthcare. In 2016, when the DA took over the city of Johannesburg, you became the MMC of Health. Tell us, and as a doctor, what do you think are some of the pressing healthcare challenges there?
I became a politician. I quit my medical profession because I felt limited in providing service or assisting my patients as a doctor. And the reason for this is because healthcare is so interconnected with basic service delivery. If you have a patient, I'll give an example of a diabetic patient, you want to put them on insulin, you tell them to keep it in the fridge, they don't have access to electricity, chances are they don't have a fridge, you tell them to eat healthy, chances are they're unemployed, they can't afford a healthy diet, all those things. Or someone with TB living in an overcrowded area who's just transmitting it everywhere, lack of ventilation because of lack of proper housing. So all those issues are basic services that are located within the local level of government. And that for me was the pull towards local government. As a doctor, I felt so disempowered and demoralized, and I realized I could not help people. I became MNC for 3 years, and I was responsible for health and social development. And in the 3 years, we already started effecting some changes. I'll speak to the preventive side, with the social determinants of health, which I spoke to. We partnered with the World Health Organization, and we started working in Region E of the city with the World Health Organization, with University of Pretoria, and various other stakeholders to design a model of primary health care that could be a model for the global community to learn from. And we were working towards WHO collaboration center status on health in all policy, which is a WHO approach to holistic health care. Unfortunately, we lost the city in 2019 and we could not achieve what we wanted to achieve, but it's something that we will be taking over when we go back after the 1st of November, and we'll make sure that we see it through. This is to make every department and every entity in the city understand their healthcare mandate, whether it's housing, whether it's Joburg water, whether it's city power, whether it's pick it up. People need to live in clean, sanitary environments in order for us to realize the health outcomes that we want. If we look at clinics, for instance, we can do a lot there. One, the biggest problem with our clinics is that it's an underfunded mandate. It is a handed down mandate from the Provincial Department of Health. And we've asked for a devolution as opposed to a delegation, because with devolution, we also get direct funds from equitable share. However, the ANC has been reluctant to devolve because they want to retain some influence and some control on particularly with agenda setting. As you know, with NHI, it's been pushed down our throats, and so on and so forth. Had it been a devolved mandate, we would have been able to maneuver better. But that's something that we need to continue pushing for, that provinces rather devolve as opposed to delegating, so that the local level of government can run health services as best as they see fit. What we did do in the 3 years that we were in government, we started extending hours of service in our clinics, which would close at 4 o'clock. We now have clinics that open later in the day, on Saturdays, Sundays, and even on public holidays. We started rolling out other services such as substance treatment services, and we also started rolling out mobile clinic services to service those underserved areas, particularly informal settlements that are far from brick and mortar structures. And as you know, the law says you need to be within a 5-kilometer radius of healthcare services.
Yeah, I mean, we've definitely done a lot based on what you just said right now. But what are some of the new initiatives that you as mayor are going to now put forth on the agenda to ensure that healthcare problems aren't a problem anymore?
So being mayor puts me in a central position and gives me really a better platform to coordinate functions across the municipality towards a healthcare agenda. It's very difficult as an MMC to try and lobby other departments to rally behind this vision. I believe that being mayor, and that's why a lot of central programs that require transversal management would be placed in the mayor's office that are so crucial, such as healthcare. We will maintain healthcare within its own portfolio, but I believe that it will be better supported from the mayor's office by creating better coordination, better buy-in, and better oversight, because other departments may not see it as their problem and they may not be as responsive, but through performance management and by including this in even the business plans of all the departments and entities, as a mayor, I'll be able to ensure that everybody speak into the healthcare mandate. So that's a real opportunity here with me coming in a different position. We will, of course, continue with the initiatives that we've already started. We'll also continue with some of the smart solutions, because some of the complaints we get from our service users are things like waiting time, inadequate staff in our clinics. I already spoke to the funding concerns where we get funded through the province, and we already subsidizing the service a lot. I even feel like we're paying more than what the province itself is spending on healthcare. So those are some of the things that would assist us a lot in improving our services. But smart solutions will really help. We had already implemented e-health, electronic health records. We had implemented queue management that's also electronic. So we're already looking at, optimizing how we process our patients through our clinics to be more patient-friendly, more patient-centered, and to really incentivize people coming into the space. So we will be looking at more innovation so that people look forward to coming to our clinics. But our healthcare workers also need to be supported. They need to feel valued. And that's something that we also started doing. Our doctors, for instance, did not even have laptops, and yet they were expected to use electronic health record systems, and they could not take work home. They could not analyze data that they were handling at work. So we also need to really support our healthcare workers and make sure that they too enjoy what they do, and they have a hunger to grow and to learn especially how to work with data, because we handle so much data that could assist us even across other departments.
Yeah, absolutely. So substance abuse is another issue that's plaguing communities across South Africa. As mayor, what will you do to tackle this issue?
So again, another passion of mine, when we started in Joburg in 2016, the city only had one substance abuse treatment center. It was a 12-bed facility for teenage boys. And every IDP meeting we went to, people were complaining about the scourge of substance abuse throughout the city. What we immediately did is we looked at loopholes in the legislation, and we saw that in the law, we are allowed to use primary healthcare facilities. And in fact, we discovered that the city of Cape Town was already doing it in our matrix clinics. And we undertook a study tour to the city of Cape Town, and we learned a lot from them, brought that model back to Johannesburg, improved on it by adding detox services within our clinics, and then we started rolling them out. So we rolled out 5 in the 3 years that we were in office, and we put aside a budget for another 2, which I believe have also been since developed. And so we're looking at about 7 at the moment. We also expanded the 12-bed to a 54-bed, and we identified a hospice that was left abandoned, and we revitalized it, we refurbished it for an inpatient facility for females. But that's me on the harm reduction side. If you look at the National Drug Master Plan, also talks about demand reduction and supply reduction. And again, you need a citywide approach. You need your GPD, which in our case established the K9 unit, which is our drug busting unit with our sniffer dogs. So very specialized crime busting unit with a focus on substance abuse. You really need that, but you need them to work with the SAPs and other law enforcement agencies, but they need to drive that. And then you need your departments like development planning to identify hubs of substance use, such as abandoned buildings. You need city parks to take better care of parks where people are using. And you need development, economic development and community development to keep people off the streets, create job opportunities, and keep people in sports, rec, and arts facilities so that they can stay off the streets and to reduce the demand for substance use and abuse.
Yeah, I mean, it is very clear that each and every resident in South Africa deserves to experience the kind of difference that all of you have spoken about. So just final thoughts. I'll start with you, Gwen. What do you want to drive home now?
Well, I mean, I don't know if my message has changed from earlier, Karabo, about the importance of what this election is about, which is essentially the local government issues that we have been discussing today. So, I mean, I do always just want to stress that, because that is the most important thing. There is nothing more important than, talking about each government or each rather political party that is campaigning in your municipality, its track record. And I think today just News 24 released an out of order index, which shows that DA, the assertion is true, that in local government, the DA governs best. And if you look at the worst performing municipalities in the country, they're either run by the ANC or the IFP. And so I think it's really important to, cut out the noise, because some people, its own promises, what it can do, of course. Every party is going to be able to make those promises. So then don't look at the promises, look at the track record and look at independent sources. And there's no doubt that whether it's Stats SA, whether it's the Auditor General, whether it's now, News 24's index, whether it's the State of Local Government Barometer that was presented to the Cocteau Committee in Parliament, pick a study, the DA comes up tops.
Yeah, thank you. Tertius?
Well, I think from my side, the 1st of November is very crucial for our voters. And many people ask us, why do we say you choose either the DA or the ANC? Where we have seen in the Western Cape and even outside of the province, where smaller parties or localized regional parties tend to actually go into coalition with the ANC. So ultimately you are voting for the ANC, irrespective if it's just by another name. But where the DA governs, we have proven that we govern better, we govern smarter, we govern with innovation, and we are also unlocking future opportunities. Now, you can either vote for a party that's stuck in the past, and at 110 they are really stuck in the past, one needs to say, or you can vote for a party that is the future leaders of this country. But it's for each community, for each voter, it's in your hands. The DA has a proven track record of what we can do, what we are doing, not wishful thinking. Our manifesto is based on fact, and fact is backed by every measurement tool that's available to show that we actually govern well, to govern in the interest of the people of this country.
Yeah. Dr. Phalatse?
Well, I'm so glad that I'm part of this webinar. We're looking at Cape Town, we're looking at what's happening in the Western Cape. Beyond just the data, we've got real large experiences, and we've got public servants who are doing amazing work, who are Democratic Alliance public servants. Johannesburg is in a broken state, and I'm saying to all our residents, this is not time to gamble on a political party that's going to try their luck at governing. It is not time to gamble on a party with no track record. We need to save our city. If we don't do it now, in 5 years' time, we will not have a city to save. I'm concerned about my children. I want to hand over a functional city to them, and I feel the sentiment of every resident of the city. When we talk about the data, there's so much evidence that the Democratic Alliance is the only party in this country today that knows how to govern, and they can be trusted and is accountable to residents. We need to be trusted on the 1st of November with those votes, so we can claim back our city and bring back its shine.
Yeah. Geordin, your last take.
South Africa has got such massive challenges, and our towns and cities are really looking in a terrible state where they are run by the ANC. We have the chance now to slowly start to rebuild. It's not going to happen overnight. It's going to take time to rebuild these towns and get them to where they need to be. But it starts on the 1st of November by electing a DA government in your town or city. And where you already have a DA government, you are one of the lucky South Africans where things work. And don't let that go by the wayside, and let the ANC back into government where you live. Make sure that you get out on the 1st of November and support the DA again in your town or city. Thank you.
So, South Africans, if you want to bring these solutions and the DA difference to your municipality, remember to vote DA on the 1st of November. I definitely shall. We've been taking your comments and questions throughout the show, and our Head of Policy, Gwen Ngwenya, will now answer your questions directly.
This is the Steenbras Dam hydroelectric power plant just outside Gordons Bay. There's an upper Steenbras Dam where water is released into the lower Steenbras Dam through 4 generating turbines in between. During peak times, or during load shedding, water released from the upper dam into the lower dam generates up to 180 megawatts of power, keeping citizens in the city of Cape Town 1 full level lower than the rest of the country during load shedding, or with no load shedding at all. The DA-run city of Cape Town is the only city in South Africa that is able to shield its residents from the worst of load shedding, keeping the lights on for longer. That's because others talk, but the DA gets things done.
First up, we have a caller from the Northwest. What's up, Northwest? What do you have to say?
I was wondering how the DA will ensure that their elected councillors in municipalities not run by the DA represent the people of that community and their issues and concerns. And also, what is the DA doing in the Northwest to ensure municipalities actually commit to service delivery?
Gwen?
So it's really important that even where we don't get into government, although I must say, obviously, the best shot that you have of turning your municipality around is to go out in your numbers to vote for the DA and make sure that we get an outright majority. But where that does not happen, of course, our aim is to make sure that we are in effective opposition. And that's also what puts us ahead of many other parties, is that we have the depth of membership and networks to make sure that even where we are not in government, we can effectively hold that government to account. We also prioritize working with the community and other important stakeholder groups, such as residents associations, to put pressure on the governing party in that municipality to make sure that they deliver. And we have always felt that communities and individuals can get so much done as well, and we need to enable them to do that, aside of just always expecting the municipality to, or the governments to deliver. So where governments are not delivering, I think it's exciting that even court cases have backed up the ability of residents to get the job done for themselves. Of course, that's not ideal. The municipality should be delivering, but where that's not possible, it's important that residents take their power back and make sure that those services still get delivered. And we are absolutely committed to making sure that more such court cases, or even where it doesn't go to court, but more battles to take the community back from ineffective governments occurs across the country.
Yeah, sure thing. Now, and our next caller is from Cape Town.
I would just like to know, in relation to local clinics, what is the DA doing to improve the state of them and improve the healthcare that local residents receive at these local clinics?
Well, one of our main interventions, particularly when we're in government in Johannesburg, as we spoke about earlier, was to ensure that also clinics stay open for longer, and also to increase the availability of mobile clinics, bearing in mind that so many people around the country are not in a position or cannot afford public transport. That's an issue we've covered in previous of these discussions, the rising costs of public transport for many households. And so it's important that where possible, we bring services directly to where people are, but that we also keep our clinics running for longer to make sure that they are more accessible. On a broader level, particularly nationally, but this does filter down to the local level as well. We absolutely have to push e-health, where more and more consultations can occur online, and this is really a practice that is spreading globally, and I think it will really help to reduce queues at clinics, so only people who really have to go to the clinic go there, but that your first port of call could be a GP who's not even maybe located where you live, so you don't actually have to rely only on the health professionals available in your area. And we know that for many around the country, that's even the problem. It's not only that they cannot get to a clinic or a hospital, it's also just that the number of specialists in the area are diminishing, and they're either immigrating or moving elsewhere in the country. So the ability to bring health professionals and health services to people directly to their homes is going to be increasingly important. And we are committed to finding those kind of innovative solutions.
Okay, 100%. And I mean, in the city of Cape Town, we've been doing an excellent job at driving healthcare access altogether. And our commitment is to do more. And the last caller we have here is from Motherwell. Hello, Motherwell.
I'm wondering, with regards to the drought, that the Eastern Cape has been experiencing, and given that this is something that has happened in Cape Town, what would be the solution to help Gqeberha save water and encourage residents to do the same?
Gwen, Nelson Mandela Bay?
Yes, so it's so important that residents and the municipality work together in order to address the water crisis, which obviously is important in Gqeberha as well, but everywhere around the country where, where water scarcity is an issue. And part of that is obviously reducing water demand. These can often be difficult conversations, and we've seen around the country there's often been resistance to the installation of water management devices or water meters. But I think there really needs to be a conversation, in municipalities, governments as well as residents, to really talk about the importance of water management and using water sparingly. I mean, there are still many people who, whether it's washing dishes, the tap is running while you're washing the dishes, people who don't reuse water that could easily be reused or used for other purposes. We still flush down a lot of potable, drinkable water in South Africa, the same water in your bathroom, same water that you can actually drink. There's a lot that we need to start thinking about, even as residents. Of course, municipalities and governments will, have an important role to play and a responsibility, but there needs to be a lot of reflection and willingness to come to the table with residents as well. And I think that's the success. No single government directive or intervention that would have worked had it not been for residents also coming to the table, monitoring their water use and being committed to driving down the amount of water they were using. And I think in the Eastern Cape, that's also going to be equally important. I mean, of course, also, we can't deny that, the return of rain also helped, although, municipalities are not in a position to control that. So what they can control is how water is used and to make sure that together we're a lot more responsible. And just finally on that point, I would say that, it's come across quite often in this conversation about the importance of collecting data and effective data management. And a key part of that was understanding water use and where the biggest users were, both in terms of households and businesses, and then leveraging that data into behavioral insights that really could start to alter the way people use water. And I think often, it really does help to know, for example, if we look around the world, to know that your household is using 3 times more water than a similar sized house, than the average similar sized household in your neighborhood, really does make you think. And I think it's using that kind of information. It can still be anonymous. You don't have to know who are the best users in your community, etc. But just knowing where you sit relative to everyone else can help also increase that level of consciousness that, you're also part of the community and the need to play the game, as it were.
Yeah, 100%. And I mean, the fact that the city of Cape Town was able to beat Day Zero, all the initiatives we have there are a clear blueprint that we will definitely employ in Nelson Mandela Bay. So unfortunately, because of time, we can only take one more question. So we have a question here from Usbusiso from Mpho, Gauteng. It says, Cyril Ramaphosa claims they are on a renewal process, but municipalities have continued to fail under his watch, and he has not provided oversight. Do you think his comments are fair, and should voters give Ramaphosa's ANC a chance?
Well, the important thing is that Ramaphosa will not be running your local municipality. So that already places that question completely out of the water. Unfortunately, I think there is an attempt to leverage the face of the president in many local municipalities. But, Ramaphosa is still going to be the national president. He's not going to be running each local municipality. That's an important thing to understand. It's also important to understand there is no incentive for renewal. So think about it, not just in politics, anywhere in life. If you reward bad behavior, there's no reason for it to change. So if you continue to purchase something, a good or a service from a company that doesn't deliver it well to you, what incentive do they have to improve what they're delivering? There's none at all. Politics is not really different. The only way to really get the message across that you are failing us, that this is not the kind of government that we expect, these are not the standards that we deserve, is to vote them out. In fact, I always like to say that there is no better gift for the ANC, or there would be no better gift than for them to lose elections, because that is really the kind of intervention that really provokes introspection and a change of behavior. But voting them back in, or voting back any government that has failed dramatically to live up to their promises and expectations is just really a recipe for more of the same, not a recipe for change.
Yeah, you absolutely have it right. Thank you so much, Join. And South Africa, to you, thank you so very much for joining us. This coming Saturday, the 23rd of October, the DA will host the Get Things Done rally live from Jersey, the city of gold. Tune in from 9 a.m. to witness an exciting performance lineup and listen to our offer from DA leader John Steenhuisen. Stay tuned to our social media for breaking news. There's a lot of those. Let's also remember to keep healthy, keep sanitized and masked up. From our hearts to yours, we say, hoi hoi, see you soon. Goodbye.
On election day, voters have a choice to make, and it's a simple one. Am I happy with the way my town or my city is being run, or do I want something different, something better? Because that's what a local government election is all about. Who do I trust to deliver services, to ensure my town is run properly, and to ensure that public money is spent on the public? Now, it's very easy to make promises. Any party can do that. But only one party has a proven track record of service delivery. I'm standing here on the Langkloof Road where the Eastern Cape becomes the Western Cape. And the road beneath my feet tells the story of the DA difference far better than I ever could. On election day, voters have to ask themselves, is this what I want? Or is that what I want? While others talk and promise, the DA gets things done.